Dr. Shikha Sharma, and today I'm going to be telling you that how to reduce inflammation. Now, let's first understand what is inflammation. And when we say inflammation, what does it mean when we talk about external inflammation, internal inflammation? What are the causes of inflammation and how to reduce inflammation? So, firstly, inflammation is a condition which can happen both outside the body and inside the body. And when we say inflammation, it means there is some kind of wounding. And because of that, some kind of wounding, now that area has become uh, compromised. The cells have become compromised, which means that they are. It's like, in simple words, you're hurt. You could be hurt outside on the skin, or you could be hurt inside in your blood vessels, or in your cells, or in your tissues. So when somebody is hurt, what happens? When somebody is hurt, there is a breakage of some kind of cells or tissues or some lining. Like here the skin the skin tissue has been broken, so you can see the inflammation. And what happens when there's an external inflammation? That initially there will be redness, there will be some bleeding, then there will be a clot, and then that clot will become hard, there'll be a scab, and then that scab will gradually fall off, and under that you can see fresh skin. That is how you see external. Now there is something which is also happening internally. So that means internally also a body is getting damaged. It's not just externally that the body is getting damaged, internally also the body is getting damaged. So how does an internal inflammation look like? Same things happen. There is an there is some kind of wounding inside the blood vessel or some tissue. Then all the platelets, all the cells, the immune cells come and cover it up. Either there is some bacteria or virus, or there is some other chemical which is damaging. It is removed from that area, and then that area is covered by that those platelets and all those things, and then slowly healing happens, and then gradually it becomes normalized. But when the internal wounding is a lot, then this inflammation or these kind of things are happening at multiple areas around the body. And because of that, a lot of fighter cells, a lot of immune cells are circulating in the system. And that is when we say that there is internal inflammation and all the inflammatory markers are high. Now you must be wondering that when I'm talking about internal inflammation, what is causing inflammation? I mean, what is it that is causing internal wounding? So, what causes internal wounding is what we are eating or what we are consuming. Suppose we are consuming a food which has a lot of chemicals. That chemical inside is going to wound us, is going to hurt us, and hurt our internal organs. Now, what are those chemicals? Obviously, you must be thinking, I don't eat chemicals, I eat normal food. But you are eating chemicals. So if you yesterday had tomato ketchup, if you yesterday had uh, a biscuit, if you yesterday had a fizzy drink, if you yesterday had a commercial pizza, if you ate any one of those things, if you ate chips, if you ate anything, just see the packet, just turn the packet around, and you will see artificial color, artificial flavor, preservatives. All these are chemicals which go inside your body and damage the cell wall, damage your some organs tissue. And when this tissue is damaged, then inflammation is happening. So that is what is internal inflammation. Now, external versus internal inflammation, if you really see, in internal inflammation, these clots can go to the heart and block the supply to the heart and give a heart attack. This inflammation can go to the kidney and cause damage in the kidney. This inflammation can go to the joints and cause problem in the joints. This inflammation can go to the lungs and cause problem in breathing. So, or the liver. So what I'm saying is, when this inflammation travels, then it starts compromising the function of the liver. Like, for example, if your hand is cut, like suppose there's a skin cut, the functionality goes down, right? You can't stretch your hand, you can't do a lot of things. The same thing is happening inside your body. The organs are not able to, act functional. They're not able to work appropriately. And that is why all those symptoms come in of fatigue, of tiredness. So many other things come up because your body is inflamed inside. Now, the question is, like I said, if you eat chemicals, if you're living in a polluted air environment, polluted water, chemicals in the food like pesticides and chemicals, and finally, I would say smoking, alcohol, tobacco, uh, and even the post pandemic, everybody has got inflammation in their bodies because the virus entered our system and triggered a lot of inflammation. So that means all of us, excepting maybe babies born much later, are carrying this inflammation, are carrying the inflammation in our system. And what is the end result? It's damaging our organs. Somebody's dying of a sudden cardiac arrest. Somebody's having kidney failure. Somebody's having problems having a baby, infertility. So that means the outcomes we are very clearly looking at. At every clinic, more and more patients are coming with internal inflammation, with all the signs and symptoms of internal inflammation. Now, the question is, okay, it's happening, but what do you do about it? What is the solution? Thankfully, the solution is in our hands and in our homes and in our kitchens. So that solution exists within our homes, and that is the best thing. It's in our hands. If we decide to follow it, we can follow the solution. So let's look at inflammation reduction. What can we do? The first thing what we can do is start having foods which are very high in antioxidants, very high in inflammation fighting. These are called inflammation fighting foods. So the number one on my list is Indian gooseberry or amla. Now, why is amla excellent for fighting inflammation? Firstly, there is enough research to prove that amla fights inflammation. There is enough data to prove. And traditionally in Indian system, amla was used to boost immunity, and it pretty much had the same impact of fighting inflammation. So now amla you have to take in different forms. One way of taking amla is you take fresh amla, you extract or you cut it into pieces and run it in the juicer, and a little bit of amla juice comes out, and drink it. If you can't drink it, dilute it with water. So add a little bit of amla juice, this much water, and drink that amla mixed water. Or what you can do is you can make the standard apple, beetroot, carrot juice and put this amla juice shot in it, and drink that every day. So what happens is that now you are drinking a powerful antioxidant which will fight your inflammation inside your body. So that is very useful. This inflammation fighting is very useful because you are taking a very powerful antioxidant called amla, and you're taking it in its natural form. You're not taking it in its unnatural form. Like, what is the unnatural form? Amla candy, amla toffee, amla XYZ. So this is the best way to take amla because the impact is very good. Now let's look at the second thing which you can take. The second thing which you can take is rhododendron flower infusion. So rhododendron flower it grows in the mountainous area, and in India it grows in the Uttarakhand area. This is a very nice red flower, and it is a very powerful inflammation reducer. It reduces inflammation in the body, extremely powerful. And this is called rhododendron. And rhododendron flower infusion is the right thing if you have been diagnosed with internal inflammation, your ESR is high, your biomarkers of inflammatory biomarkers are high, then this is something which you can take, and it reduces the inflammation. Now, how do you take it? So the easiest way is rhododendron herbal teas are available. So you just have to take that herbal tea and drink that herbal tea every day. Uh, and it's like a bag, like a tea bag, and you just put hot water, put that, and drink that. If you don't want to drink it as a herbal tea, then you can buy rhododendron powder, and that you can put it in hot water, infuse it overnight, and the next day drink that water. So that are two ways of taking rhododendron. Very powerful anti-inflammatory, very well researched, and has been And in Uttarakhand area, they take it for many disorders, which all are connected to inflammation. But it's a traditional medicine over there. It's that flower is a traditional medicine. In fact, they don't even take it if they have a problem. They even take it if they don't have a problem, because it's also good, something good for health. So they take it as a drink, as a cool beverage, sometimes a hot beverage, but they take it in season. The third thing to fight inflammation, and which is very important, is uh, very critical, is change your oil. Do not take refined oil. Refined oil will cause inflammation, so do not take refined oil. The more refined oil you take, the more chances of inflammation rising in your system. So, what is refined oil? So, a lot of people don't understand what refined oil is. Any oil which is heavily processed and heavily refined has a lot of chemicals added to the processing in the during the processing time into the oil. And therefore, when you take this refined oil, you're actually just drinking chemicals. Like, for example, when we talk about flavored beverages, there are a lot of flavored beverages in the market. It's like drinking a perfume, because they have nice flavor, they have nice aroma, but it's all chemical. So, why do you want to drink flavored beverages? Similarly, it is very important to understand that oils which have chemicals in them, you're drinking chemicals. You don't need those chemicals. So, have cold pressed oils of anything, like whether it is mustard seed, which is sarson oil, or whether it is til oil, which is sesame oil, or whether it is olive oil, or whether it is peanut oil. Always take virgin and cold press. Do not go for these refined oils, which actually mix a lot of oils and plus chemicals, plus bleaching agent. So it's a chemical cocktail. The next thing, if you want to reduce inflammation, is you need to have at least 300 ml of vegetable juice in your diet, and 500 grams of salad in your diet on a daily basis. Now, why I'm saying 300 ml of vegetable juice and 500 grams of salad in your diet? It's because vegetables are very powerful antioxidant and probiotics also. So they worked at two levels. One level is that they are working as antioxidants. The second level, they're working as probiotics in the gut. And our immunity lies in the gut. So if our gut is not healthy, our immunity is not going to be healthy. Our immunity will not be there. And therefore, it is very important that when you are uh, looking at reducing inflammation, you need to push your vegetable juices up, which are also very rich in enzymes. Many people don't know any food which is cooked, any food has zero enzymes. And enzymes are very important for your body. So vegetable juices have, like, a lot of people argue that no, I'm having sabzi, it's okay. I'm having cooked vegetable juice. Well, cooked vegetable, I don't need vegetable juices. You do, because cooked vegetable will not have those enzymes which raw vegetable has, and obviously you can't eat raw vegetables. So the best way is to juice them. And one of the uh, I would say treatment modalities, whether it is in Europe or whether it's in India, is naturopathy. So the naturopathy way of looking at juices, vegetable juices, is very important, and that is what helps people to be treated. And therefore, uh, taking vegetable juices in your diet is critical. It's very important. So 300 ml of vegetable juice, you can take apple, beetroot. Apple, of course, is not a vegetable, but just for flavor, you're adding it. So beetroot, carrot. Then you can wash spinach nicely and add a little spinach. You can add ginger. You can add a little bit of raw turmeric also, green turmeric. The raw turmeric, which is also very good. You can add a little bit of fenugreek. So all these mint. So this becomes very nice. You can add lemongrass. So all of them give a nice flavor. At the same time, they're delicious. They're healthy for you. So that is what you have to do. So that is where, as far as it goes for vegetables and vegetable juices. And of course, vegetables when you're making, please don't put tons of refined oil. Please make sure you're adding, extra virgin olive oil. You're cooking them in extra virgin olive oil, or just adding a little bit of dressing which is made from natural organic oils. And then of course you can decorate it with a little bit of sesame seeds, a little bit of flax seeds, maybe some shredded almonds, some like walnuts. So all these are giving you natural omega-3 fatty acids, which are very good for the brain, very good for the nervous system, very good for the eyes. So that is, of course, something which you must have to reduce inflammation. Salads, 500 grams every day. You can break it into two meals, 250 grams and 250 grams, or you can have it one together. In fact, you can make a salad meal, which means you have these, you can have lettuce, you can have gherkins, you can have, and plus you can have some protein. Like you can put boiled chickpeas, or you can put boiled peas, or you can put, say, boiled. Uh, um, Black gram. Black gram is wonderful. It's very powerful, very good. So you can add a little bit of this protein, and then you can put lettuce. You can put steamed vegetables, broccoli, or any one of the squashes, uh, and that becomes a wonderful combination. Now, when you're reducing inflammation and when you're doing this, another thing which is very important is watch your inflammatory markers.